Hello everyone, welcome to the Health Ed channel. Today I'm going to cover another important medical emergency, heart attack. 10 things everyone has to know about heart attack. Number 1. Heart attack is the leading cause of death in the US and worldwide. 650,000 people in America, and 18 million worldwide die from heart disease each year, which accounts for around 25 to 30% of total death toll. Around 800,000 Americans have heart attack each year. That equals to one person every 40 seconds. Statistics showed that this condition costs the US over $200 billion each year. Number 2. Know the terminology. Here is when things get a little bit confusing, as there are a lot of medical terms concerning heart diseases. I'll try to explain different concepts in a simple manner, so you know what your doctor is referring to. First of all, ischemia means reduced blood perfusion. Ischemic heart disease, IHD, refers to the reduction or restriction of blood flow and its oxygen to the heart muscles. It is usually caused by coronary artery disease, which is the narrowing of the vessel supplying the heart, due to atherosclerosis, the buildup of plaques in the arterial walls. It has wide spectrum of diseases including acute and chronic conditions. In its acute form, we use the term acute coronary syndrome, ACS, which is the acute presentation of heart ischemia due to sudden blockage of a coronary artery, usually caused by the rupture of a plaque in the artery. This includes heart attack and unstable angina. Heart attack, or myocardial infarction, MI, occurs due to blockage of a coronary artery leading to death of heart muscles. Angina is another term commonly used and easily mixed up. It refers to situation when there is reduced blood flow to the heart due to narrowed coronary arteries, but unlike a heart attack, it does not cause permanent heart damage. Some may also confuse cardiac arrest with the terms above. Cardiac arrest is when the heart beats chaotically or stop beating altogether, leading to absence of blood circulating through the body. Heart attack is a common cause of cardiac arrest, but they are not necessarily related. Most heart attacks do not lead to cardiac arrest. And there are many other potential causes of cardiac arrest. Number 3. Symptoms of heart attack. Heart attack occurs suddenly, commonly presenting with chest pain or discomfort radiating to shoulder, neck, or jaw area. The reason why these areas may experience pain is because the heart and these areas send their sensory signals through the same spinal cord segments to the brain. Our brain may not be able to differentiate the origin of sensory signals and thus would feel pain from these areas. Other symptoms people might have during heart attack include sweating, shortness of breath, lightheadedness, and feeling weak. Women may have different heart attack symptoms. Nausea, indigestion, and shoulder ache may be experienced instead of the classic chest pain. Surprising, 1 in 5 heart attacks is silent. Number 4. Most heart attacks happen on Monday mornings, similar to stroke. There are a number of possible explanations, including blood pressure and heart rate fluctuations, stickier blood platelets, dehydration status, stress hormones being at their peak, and so on. Interestingly, heart attacks are also more likely to happen around your birthday, Christmas Day, and New Year's Day. So being too emotional, both stressed or excited, triggers heart attacks. Number 5. Have an action plan in case of heart attack. If you haven't been diagnosed with angina and this is the first time you experience the above symptoms, immediately stop what you're doing, rest, tell people around you what you're feeling, and call the ambulance immediately. Paramedics may give you an aspirin pill. Chew it instead of swallow it, as chewing helps your body absorbing the medication quicker. If you have been diagnosed angina, follow the angina action plan recommended by the American Heart Association. Take a puff of GTN spray upon onset of angina symptoms, wait 5 minutes and take one more puff. If symptoms still persist after another 5 minutes, call the ambulance. Number 6. Tests for coronary artery disease. Upon arrival to the emergency department, an electrocardiogram, ECG, and cardiac enzymes are essential tests. ECG measures the electrical activity in your heart. While cardiac enzymes would be raised in case of heart attacks due to the release of enzymes from heart muscles during ischemia. These tests are useful in determining whether you are having heart attack and its severity. A simple concept of the ECG is that it differentiates ST elevation MI, complete blockage of coronary arteries, from non-ST elevation MI, partial blockage of coronary arteries. Subsequent test includes cardiac catheterization with coronary angiogram. This test is done by inserting a catheter through the vessels from your leg or arm to your heart, then contrast is injected and an imaging of your coronary arteries are obtained to test its patency. Number 7. Reperfusion is key. When it comes to heart attack, prompt restoration of blood flow to heart muscles is essential to optimize salvage of heart muscles and reduce mortality. PCI is the preferred reperfusion strategy for most patients with ST elevation MI. It is done after coronary angiogram is obtained from cardiac catheterization in same session. A catheter wire is manipulated through the blockage in coronary arteries, then the narrowing of the blood vessel would be dilated with a balloon, and stent could be placed to maintain its patency. Fibrinolytics is another option for reperfusion. They are medications used for dissolving the plaque in coronary arteries. Bypass surgery is infrequently performed for patient with myocardial infarction unless previous treatments failed or there are significant heart mechanical complications due to the heart attack. Number 8. Door to balloon time. This is an important concept concerning heart attack, just as marking the onset time of stroke is. If you haven't watched my previous video on stroke and learn the concept of stroke onset time, make sure to watch it. These knowledges come in handy just in case you or your loved ones unfortunately encountered these conditions. Door to balloon time is a key performance quality metric in the treatment of heart attacks for patients needing PCI intervention. It times the interval from the patient's arrival in the emergency department, to the time when a catheter guide wire crosses the blockage of coronary arteries with the restoration of blood flow to the heart muscles. The American Heart Association guidelines recommend a door-to-balloon interval of no more than 90 minutes. Number 9. Common medications for ischemic heart diseases. The most commonly used medication is aspirin, which is an antiplatelet therapy that reduces chance of further heart attacks. However, it increases risks of bleeding especially in the digestive tract, so the decision to recommend aspirin has to be based upon individual clinical judgment. Next is statin, which is medication used for lowering blood cholesterol. It is recommended that all patients with atherosclerotic cardiovascular disease should be treated with statin. Then we have nitrates, which could be in spray or pill formula. They are medications that dilate your blood vessels, which can help to relieve pain in patients experiencing angina. Other medications to control diabetes and blood pressure may also be prescribed depending on individual situation. Number 10. Lifestyle modification. Similar to stroke, a healthy lifestyle plays a major role in reducing the chance of having a heart attack. Many studies have shown the significance of addressing behavioral risk factors in reducing cardiovascular disease and its death. Stop smoking as it damages your blood vessels and heart. Statistics have shown reduction in hospital admissions due to heart diseases after enrollment in smoking cessation program. Limit alcohol consumption to no more than 2 drinks per day for men and no more than 1 drink per day for women. Reduce stress. Laughter is a good prescription for your heart. It relaxes and expands blood vessels, causing increased blood flow up to 20%. Spend time with friends and family. People who live alone are 2 times more likely to have heart attack than people with a partner or roommate. Regular exercise. Research has found that racket sports, swimming, aerobics, and cycling have the greatest protection against cardiac death. It is postulated that these sports have higher cardiovascular demand with engagement of both upper and lower body. Also, have good control of your hypertension, diabetes, and high blood cholesterol. The main takeaway is that with heart attack being the leading cause of death, everyone should equip themselves with knowledge on its symptoms. Know what to do when having a heart attack. And know that reperfusion is key when it comes to heart attack. If you think this video is useful, share and spread its information to your friends and family. It may serve to save their lives. If you want to receive more health knowledge, be sure to like this video and subscribe to my channel. Your support is vital in motivating me to continue my work on spreading useful health info. See you next time.